for your support of Porridge for Parkinson's and your continuing commitment to the fundraising we are doing for research into Parkinson's disease. Thanks to you, we were able to establish the first ever Porridge for Parkinson's Toronto pilot project grant. This is a one-year award of $45,000, enabling Dr. Schlossmacher and his colleague, Dr. Juliana Tomlinson, who not only has received the award this year, also had a baby, so she's a force of nature. And before we formally introduce our guest speaker, I would like to thank everyone else who has brought us here tonight. I'm going to quote from Andy Berry from CBC, who sent us his regrets and had his kindest wishes for us, to thank us for our hard and loving work, which is what everybody in this room does. So please, when I call your name, if you could stand up as well, those members of the committee. To Jenny Ginder and Sheila Knox, who are the co-chairs for 2009, who really are responsible for this, for their kind and loving work. And the committee members, including Bev Biederman, Beth Solman, Barbara Walsh, Marcia Bailey, Elizabeth Deacon, just left, Hannah Etland-Stein, and Debbie Perna. So to formally introduce Dr. Schlossmacher, and time is short, I'd like to ask Ivy if she would come up now and say a few words.
Thank you, Debbie. It's particularly fitting that we have Michael Schlossmacher here today, particularly because we are just about to kick off Parkinson Awareness Month on the 1st of April. And Michael has asked me to make it very short because he's eager to speak to you today. Michael was raised in Vienna, Austria, and he moved to Boston. He moved to Boston after obtaining his medical degree to work with Dennis Selko at Harvard University. In 2000, he redirected his focus from Alzheimer's disease to Parkinson's disease, and he moved to the University of Ottawa to work with an already established Parkinson research group in 2007. He's currently the Associate Professor of Medicine Neurology with cross-appointment to the Department of Cellular and Molecular Medicine, and he also holds the Canada Research Chair in Parkinson's disease at the University of Ottawa. Michael is a physician scientist, and his goal is to contribute to the improved care of patients with Parkinson's disease and other neurodegenerative conditions. As a physician scientist, this gives him a really unique and important insight into not only treating people with Parkinson's, but also he can take what he's learned from clinic and then apply it to his research. Currently, he's working on biomarker discovery and the identification of drug targets. And one thing I wanted to say firstly is that Margie Zaks came into my office and she asked me what puts a smile on my face when Michael contacts me. And it's the fact that he is so personable, and he has always been willing to help the organization when we've asked him to assist, whether it's helping us to respond to media calls or just to provide additional information to questions that we're receiving on research. In particular, he is very involved in the Parkinson's Society Ottawa organization, and he even participates in their super walk. One thing I wanted to say about this grant that he has received is that the monies that Porridge for Parkinson have provided to Dr. Schlossmacher, for me, it's really important that we do receive these contributions, because our program is small and they do go a long way, and I, as director of the program,